Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide information, education, commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people much like yourself so that you can stay healthy and perform your best. And one of the questions I get so much, it's the nature of sports medicine, is when can I get back to football or soccer, or when can I get back to jogging? When can I train for a marathon again after an injury? And it could be a non-operative injury like an ankle sprain or a hamstring strain. It can be, when can I get back to sports or exercise after undergoing surgery like an ankle fracture or like a rotator cuff repair or a meniscus surgery. It's one of the most common questions we get. So in this Ask Dr. Geier video, I address that exact question and how you make that decision for one of the most common injuries and surgeries in all of sports medicine, and that's ACL reconstruction. Okay, Slade asks, hi, I'm a professional rugby league player in Australia. Very cool. I've undergone my second reconstruction on my left knee. The hamstring graft failed, so now I have the patellar graft. Do you think there's an optimum time to come back to contact sports? I came back at 10 months. I'm thinking about waiting 12 months this time. Any thoughts on this? Well, absolutely, I have thoughts on it. One of the things that I think surprises a lot of people is that the amount of time in actual days and weeks and months isn't really what's important. With ankle sprains and maybe hamstring strains, we talk about maybe it's a week or 2 to 4 weeks, but there's nothing magical about that point in time. That's typically an average based on that particular injury and an average among all different types of athletes. But there's a lot of factors, how bad the injury was, how quickly somebody heals, how quickly they get motion and strength back, and what sport or exercise they're trying to get back. Now, we used to say with ACL tears, it's a 6 months recovery, 6 months to get back to sports, and that was based on how long it took the graft, the patella tendon graft or a hamstring tendon graft or a cadaver graft, an allograft, how long it took your body to incorporate that graft, meaning how long does it take you to get that graft to basically become part of your knee and stabilize that knee just like your ACL did before it tore. And that process, when you look at basically studies of that have been done over the years, typically that process takes about 6 months. But again, that's only one factor. Obviously, sooner than the graft is incorporated, you risk re-tearing it. So we typically don't like people to go back. Occasionally you get people back before 6 months, but that's probably the exception rather than the rule. In my experience, it's about 9 to 12 months before most high-level athletes get back to sports and exercise. And again, the amount of time, be it 6 months or 9 months or 12 months, isn't really the factor. What makes that determination is when an athlete gets all his motion back, when he gets all his strength back. And we usually try to do that. It's a process with physical therapy, but it's a process, you get most of that back in the first maybe 3 to 4 months. Then you start jogging. Then you start real functional training, landing on it, cutting and pivoting on it, working on agility drills, single leg strengthening, single leg landing, and all sorts of activities that replicate what you do in your sport or in your exercise. And a lot of that depends, again, on what it is you do. Getting back to being able to do layups and dunks in basketball, or going up for headers in soccer, or if you're a wide receiver in football, being able to run and plan on it and change directions. There's a lot of different variables, but a physical therapist can work on that with you and at least replicate that in physical therapy. Now, obviously, then there's a progression back to sports, trying drills on the field and then maybe working back into practice. And depending on how it feels, you gradually can work back into it. Obviously, through that process, the orthopedic surgeon is examining your knee and feeling to make sure it's stable. There's, in the past, and sometimes we still do this, there's strength tests that we can use to compare your strength on the surgical knee compared to the other knee. There's a lot of factors that go into it, and a lot of that plays a role much more than just how much time it's been for surgery. Plus, as I write about a lot on my website, there is a very real phenomenon of fear of re-injury, and so that's something a lot of athletes overcome. Or if it isn't fear that you're going to re-hurt it, it's just that it doesn't feel normal. A lot of people tell me it's their second season back in their sport before their knee really feels normal, and that's something that we really have to work through. It gets better with time, but again, this is a long journey. So is it 6 months, or in Slade's case 10 months or 12 months? It's as long as it takes for your knee to have full strength, full motion, full function. You regain your sport-specific functions, and then it feels normal to you. And fortunately, ACL surgery has good success rates at getting people back to sports, but again, it's a lot of work, it's a lot of time. Not just a lot of work on your part, but working with an athletic trainer and a physical therapist, obviously with the orthopedic surgeon as well. Now, have you had ACL surgery, and how long did it take you to get back to sports? And what did you do to get back and play at the same level you were before you got hurt? I'd love to hear your thoughts. So below this video, I'd love for you to leave your comments. I'd love to read them, and I'll try to reply to your comments as well. Now, if you have a friend or family member that has torn his or her ACL, or maybe recovering from ACL surgery, I'd love it if you'd share this video with him or with her, so that hopefully it can help him or her recover or maybe prepare for the surgery and for the post-operative return to sports. Now, if you like more videos like this, or want more videos on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record 1 or 2 of these a week, and they'll be delivered straight to you. And last, go to my website, drdavidgeier.com. I would love it if you'd sign up for my email list, and that's where I share some resources on staying healthy and performing your best in sports and exercise that I only share by email. So if you sign up, those will be delivered to you on a regular basis. Thank you so much for watching. I hope this video was helpful. I hope you aren't recovering from an ACL injury, but if you are, I hope this video was helpful for you, and I look forward to seeing you right here next time.